And from the heart, thank you, Minister, for all what you're doing for us. And we look forward to working with you going forward to do even more for healthcare and for nursing. The Honourable Sylvia Jones is currently Ontario's Deputy Premier and Minister of Health, where her focus is building a strong healthcare system for all Ontarians. Minister Jones previously served as the Solicitor General from 2019 to 2022, where she championed public safety initiatives, including leading the country with a $307 million anti-human trafficking strategy and legislation, and passing Canada's toughest animal protection legislation. Minister Jones has lived in Dufferin, Caledon for over 30 years with her husband, David. Welcome, Minister.
Could this podium be any bigger? Thank you, Claudette. Appreciate that. And Doris, for your kind words. You know, I reflect back on how far we have come since I've last spoken to you and your organization. And I have to say, we've moved a lot of files forward. So thank you for your advocacy. Thank you for your work. Thank you for your partnership. You know, this truly does not work if we do not have partners who are willing to work with us and move forward a positive patient experience. So that is very important to me. And Claudette, for your leadership. Doris, it is important that we continue these conversations because we're not done. There are so many opportunities, whether it is in scope of practice, whether it is the potential to continue to expand primary care across Ontario. It's really important that we work on all of these pieces together to make sure that we remember and we are always working towards that patient-centered experience. So thank you for inviting me to have an opportunity to speak to you today and to celebrate registered nurses, nurse practitioners, and nursing students in Ontario. I want to thank again Doris and Claudette for your leadership and for the invitation to join you here for your 24th annual Queen's Park Day. Good on you. Congratulations. Under the leadership of Premier Ford, our government has been making record investments in healthcare. Through our comprehensive Your Health plan, introduced 1 year ago, we are building a healthcare system that provides Ontarians with the right care in the right place by connecting patients to more convenient care options closer to home. To support this, our government has been taking bold action to support and grow our healthcare workforce now and for years to come. And we are starting to see those results. With our plan for the second year in a row, we have seen a record-breaking year of over 17,000 new nurses registered to work in Ontario, and another 30,000 nursing students currently studying at one of Ontario's colleges or universities. Since 2018, 80,000 nurses have been added to our healthcare system through programs like the Community Commitment Program for Nurses and the Learn and Stay Grant, which provides a financial incentive or tuition coverage to nurses, including nurse practitioners, in exchange for a period of service in an area of highest need. Our government is supporting the future nursing workforce while bringing care to communities that need it the most. Working together with 9 Ontario universities, we have added 121 nurse training positions to the primary care nurse practitioner program, bringing the total number of nurse practitioner training positions up to 321 at schools across the province. And I have to say, you know, I just came out of a meeting, and we need to celebrate our success more here in Ontario. So nurse practitioners in Ontario, anybody know how many we have? 5,000. Across Canada? 7,000. That's not 40%. We are leading Canada in nurse practitioners, and we can continue to do that in so many areas. With this expansion, Ontario has more nurse practitioner seats available than ever before, ensuring more Ontarians can connect to high-quality care when and where they need it. Increasing access to nurse practitioner education is one more way our government is taking decisive action to ensure there is a pipeline of skilled healthcare workforce for future decades and generations, to help ensure Ontarians can access convenient and connected care closer to home for years to come. Our government knows that nurses play a critical role in patients' healthcare journey. They work in primary care, long-term care, hospitals, public health units, and in many other community settings, providing a full range of healthcare services, including, of course, prescribing, ordering, and interpreting tests, and diagnosing and treating illnesses. In fact, I'm proud to say that just yesterday, as Doris mentioned, we recognized the very first RN in Ontario now authorized to prescribe medication since we announced scope of practice changes in November. Congratulations. And our government is proud that Ontario is one of the first in Canada to adopt the nurse practitioner-led clinic model, investing over $46 million each year to fund 25 nursing practitioner-led clinics across Ontario, connecting nearly 100,000 patients to the primary care they need. Ontario currently leads the country with 90% of people connected to a regular healthcare provider. But while we're pleased with this progress, we know that there is more that we can do. And I was thrilled to stand beside Doris and Claudette, your leadership, earlier this month to announce our government's record investment of $110 million to connect over 300,000 people to 78 new and expanded primary care teams, including nurse practitioner-led clinics and family health teams consisting of nurse practitioners and registered nurses. The Ministry of Health modeling shows that our initiative combined will help connect up to 98% of people in Ontario to primary care over the next several years. We've made a lot of steady progress over the past year, but we know there is more that we can do. Our government will continue to work hand in hand with healthcare partners like the RNAO to take bold action to provide Ontarians with the right care in the right place. Thank you again to our world-class nurses and all of you in attendance today for the incredible care you continue to provide patients and families in communities across Ontario. It is noticed, it is appreciated, and we want to be there hand in hand to work with you to make sure that we continue this incredibly important work. Thank you. Stay well.